Hello everyone, welcome to Dentospedia, the most trusted platform specifically designed to help you excel in your dental board exams. So today I'm going to teach you a short topic on space maintenance and space regaining. So let's begin with the topic. So first we'll discuss space maintenance, keeping the space. So see, when it is used, what is the purpose? See, the purpose is to preserve or recreate the arch length following premature loss of a primary teeth, thereby preventing crowding, impaction, or malalignment of the permanent successors. And now the space needs to be regained for the permanent tooth to come in. So appliances are used. So see, these devices actively push the teeth apart to create the necessary room. Now they include open coil springs, lip bumpers, or active loop device. See, open lip springs, open coil springs, lip bumpers, or active loop devices. Now often followed by passive space maintainers. Now once the space is regained, it is often followed by a passive space maintainer. So once the space is regained, it is often followed by a passive space maintainer to hold the space open permanently. Understood? So see, there is a Dentospedia poll which states maintain space before it is lost. So maintain the space before it is lost, regain it only if you must. Now prevention is easier than the correction. So the main philosophy is maintain space before it is lost, regain it only if you must. Prevention is easier than correction. In simple terms, it is better to keep the space open than to try and force it to open it later. Understood? Now next is appliance, band and loop, nance and lingual arch and distal shoe. So these are some of the space maintainers. So see, these devices are essential tools in interceptive orthodontics to hold or guide teeth into their correct position, when a primary teeth is lost too soon. So the main appliances are band and loop, nance holding arch, lingual arch, and distal shoe. Now each one is used for a specific situation depending on which tooth is lost, where it is, and on the jaw. Understood? So see, first is band and loop space maintainer. Band and loop. So it is a simple fixed wire and band device. A band is put on one tooth and a wire loop touches the tooth on the other side of the gap. Understood? So you can see in the image, it is a band and it is a loop. So it is a simple fixed unilateral device and maintains the space after loss of one molar. Now it is easy to fabricate and minimal tissue irritation. Understood? Now used when a single primary molar is lost on one side of the jaw. Understood? Now you can see crown and loop. Now it is similar to the band and loop but uses a stainless steel crown. You can see stainless steel crown. Understand? Now used when the tooth next to the gap or abutment teeth is already decayed or carious. Understand? And it needs to be restored. So there is a palatal acrylic button which prevents the mesial drift of the upper molars. Now it is common for bilateral maxillary arch space maintenance. So see, a wire that connects the upper posterior to the acrylic button that rests on the roof of the mouth, which is the palate. Understand? You can see it is a acrylic button. It is a acrylic button connected with the wire. Understand? And adjoined with the loop and adjoined with the molars. Understand? You can see. Now see, used to maintain the space on both sides of the upper jaw. Bilaterally upper space maintenance. Now the palatal button prevents the upper molars from drifting forward. Understand? Now it will prevent to drift it forward. Understand? So it is nance appliance. Nance holding arch. Next will be lingual arch appliance. Lingual arch appliance. So see, fixed wire soldered to lower molars running along the lingual surface. You can see a wire is soldered here and it is displaced lingually. Understand? Now it prevents anterior crowding by preserving the leeway space. So see, a fixed wire that connects the lower posterior molars. You can see lower posterior molars running along inside. Now it is used to maintain the space on both the side of the lower jaw. Understood? So it is also a bilateral lower space maintainer. Now it also preserves leeway space, helps to prevent crowding. Understand? It helps to prevent the crowding. Next will be distal shoe appliance. So see, it is a subgingival extension which directs eruption of an unerupted first permanent molar. Now it is a complex appliance with a part that extends below the gum line or below the gingiva. It is a subgingival extension. Understood? Now used when the second primary molar is lost before the first permanent molar erupts. Understand? Now it directly guides the unerupted permanent molar into the correct position. So it is a distal shoe space maintainer. So that was space maintenance and space regaining. So for more detailed video, please follow our page Dentospedia and please do like, share and subscribe our channel. Thank you very much.